Well, indeed, the session was suggested by the panel on cognitive disorders of AN, Sofia Toniolo, and by young researchers and research fellows and the residents, because it's a topic which is becoming more and more important. In all Europe, we have more and more people, immigrants, refugees, and so on, people who speak other languages, and therefore it becomes relevant to be able to diagnose aphasia also in different languages. Now, the opening talk was by my colleague Stefano Cappa, and he was stressing that the different types of aphasia are not just something that we observe from observation of language, but also they have different pathological and anatomical correlates. So from this point of view, there has been a lot of progress in the functional neuroanatomy and our understanding of aphasia. So we distinguish three big groups in progressive aphasia: the non-fluent progressive aphasia, the semantic dementia, and logopenic aphasia. For instance, just to start with a very practical example, I mentioned the three types of aphasia, one of them being semantic dementia. Now, most work on semantic dementia has been in patients who spoke English as their first language. The problem is, in Europe, the majority of Indo-European languages have grammatical gender. From Portuguese to Russian, we have male, female, neutral in some languages, and so on. This has implications for the way how, for instance, aphasia manifests itself. So one of the examples I give is that in Spanish, patients make errors in their they will use, for instance, la instead of l. They will make errors. This is something which we will never find out in English, because English doesn't have grammatical gender. There are many languages, particularly in Eastern Europe, which are morphologically very complex. In this case, if patient has, for instance, agrammatism, it will show itself very differently from what we will see in an English language-speaking patient. So from this point of view, if all our understanding of aphasia is based on observations in English, we are missing a lot of very relevant ways in which aphasia manifests itself in other languages.